let's go. Guidelines for patient positioning. So what are the guidelines? If you have to position a patient, what guidelines should you follow? The first guideline is, because you want to ensure safety and prevent injury during patient positioning, you want to adhere to some guidelines. The first thing is that you want to explain the procedure to the client or to the patient. Explain. You need to know, why are we putting you in this position? So you can be comfortable. Some positions help them to breathe better, right? And as you communicate to the client may tell you, I feel comfortable, I don't feel comfortable. Okay. The second thing is, because the clients have their autonomy, in other words, they're able to make decisions on their own in most of the cases, you also want to let the client participate fully with you. Encourage patient participation. Why? Because if the patient doesn't know why you are putting him in that particular position, he may not cooperate with you. But if you tell him, we are doing this particular procedure and therefore we need you in this position, the client will be able to easily adjust to that. All right? Now, another reason, or why should we have these guidelines for patient positioning? It is to seek adequate assistance. When repositioning the patient, you want to involve other caregivers if necessary, because you don't want to break your back, or you don't want to do everything on your own. If you need to stretch out your hand and get some help, okay? And another reason, or another thing which should guide us when we are positioning patients, is to be able to utilize mechanical aids, okay, where you can use things like bed boards, slide boards, pillows, patient lifts, slings, to facilitate safe and efficient positioning of the patient. And you also want to learn how to adjust the height of the bed. Adjusting the height of the bed, okay? And you also are learning about positioning so that you'll be able to implement frequent positional changes which the patient may need, and ensure that no position is maintained for an extended period of time, which will make the patient uncomfortable. So the principle here is that you want to reposition the patient every 2 hours to prevent complications like pressure ulcers. You want to reposition the patient every 2 hours if necessary. Another reason why you also want to learn about patient positioning is to avoid friction and sharing of the skin, right? Because if you don't position the patient well, there will be a lot of friction and sharing of the skin, and that can lead to a lot of ulcers and complications. So now, if you have to position a patient, what are the things you want to do? First, you want to maintain proper body mechanics. In other words, where should the leg be? Where should the hand be? Where should the neck be? Where should the back be? Okay. The first thing is that for positioning, you want to stay close to the patient. For yourself, for alignment, you want to keep your back, your neck, and the pelvis aligned to avoid twisting. Okay. And then knee flexion, you want to flex your knees and keep your feet wide apart, so that it can give you good body mechanics. And the muscle use your arms and legs for lifting, not your back. So when you are positioning the patient, always make sure that you're not straining your own back, because we are in this nursing thing for a very long time. You don't want to get injuries associated with positioning the patient, and that can end your nursing career. All right. And muscle preparation. You also want to tighten abdominal and gluteal muscles before moving the patient, so that your body is in a proper alignment, in order that when you are moving the patient, it becomes easier. And you also want to coordinate with others. You don't want to do the work alone. Okay. So now what we're going to do now is to get into to learn various positions that we can keep the patient in. What are the various positions?